Hi, everybody. As you know, I am Cheryl Hutto, a life coach supporting caregivers who are caring for loved ones, predominantly family caregivers. And I am really pleased to have with me today Dr. Gerda Maissel. And Dr. Maissel is going to describe to you what she does, but she offers a concierge style consultation service for anybody across the country. Welcome, doctor. How you
Well,
doing?
thanks. Hi, it's great to be here. Thanks for having me. I feel like I'm on your show. Woohoo!
There
From
we are.
my dining room. It's great.
Tell us where you are and a little more, I can't describe adequately what you do,
Sure.
so go ahead.
Sure. Well, I'm happy to. So I work as an individualized healthcare advocate, or some people call it a personalized healthcare advocate. And what that means is I take my clinical background, which happens to be in a field called physical medicine and rehabilitation. I weave in my knowledge of all the different levels of care and my experience of having worked as a healthcare executive for about a dozen years. And I combine all of those things to help people on their healthcare journey. So with that said, so many people get frustrated. They feel like they're at the mercy of the healthcare system. They just don't know where to turn, or they go online and they get a whole bunch of information and they don't know what it means. And so with this service, I do what people need. So it might be translating medical information, it might be guiding them, it might be assessing their care, it could be just staying with them with, while they're on their journey and helping them make decisions that make sense for them. Because, when you go to the doctor, sometimes it's like, here, take this pill. And then you go home and you've got to decide, do I take the pill? Do I not take the pill?
Right.
And I don't think in medicine, we've always done a great job of saying, well, if you take the pill, here's the pros and cons of taking the pill. If you don't take the pill, here's the pros and cons of not taking the pill. And so I help fill in some of those gaps for people.
Oh, I love this. I'm thinking of all sorts of examples as you're speaking. Very often these caregivers you're right, they are just handed pills for the person they're caring for, and they get home and they don't know the side effects.
Mhm.
And so often, especially if someone has dementia, a pill that works for somebody who doesn't have dementia is not a good idea for someone who does. And then they end up having all sorts of side effects, and then they have to get off of it. And
Mhm.
so you could actually be someone that they could rely on, like Dr. Maissel. My doctor's telling me that, my husband should take X, Y, or Z. Could you just give me your opinion? Is that something, would you be able
Yeah,
to do? Yeah,
to some extent, yeah. I mean, I have to be careful because I'm not anybody's doctor. I'm
right.
not functioning as a person's doctor. So what I can do is say, well, in people like you who have a condition like you, here's what this might mean. And here's the information, and here are the choices. So I'll give you an example. It might help. It's something that most people are familiar with. DVT, deep venous thrombosis. It's a clot, and people get them in their legs. And it's pretty common that somebody gets a clot in their leg. Doctor says, here, take this medicine. There's, some newer medicines, but generally it's, here, go take this medicine. Well, that's appropriate and that's the right treatment for a DVT. But what if you're a fragile elder, or you're caring for a fragile elder, and that person is now anticoagulated, meaning their blood is thin? Well, if that person whose blood is thin falls and hits their head, they can get a very severe bleeding in the brain, subdural hematoma. And so for that fragile elder, taking that anticoagulant to treat the DVT brings with it a bunch of additional risks.
Right.
Now, not taking that pill also has risks. Sometimes we say, oh, the clot can travel, and that sounds bad. But do people understand what it means when we say the clot will travel? Well, what that means is it goes to your lungs, and it can cause a pulmonary embolus, which could be fatal, like that subdural you get if you take it, but it could also cause some shortness of breath that might not be fatal. But if you choose not to take the pill, you need to know what to look out for. And there's other treatments that, I'm not here to talk about DVTs, but it's an example of it's not always as simple to just take the pill or even know the side effects. You need to know what happens if you do it, what are those risks, and what happens if you don't do it.
Right. That's perfect. That's really great. I'm also thinking a couple of times now. I know caregivers who loved ones are. It seems as though they're really advanced and they've stopped swallowing, and then they go to
Yes.
soft foods or even onto a feeding tube, and people just, the care person just flips out thinking, where am I in this process? What should I do? And then all of a sudden the person starts being able to swallow again. And that's when I can see that people would be like, what's real? What's
Right.
going on? And
Right.
a person like a doctor like yourself that they could call to lean on, it seems to me would be such a godsend. What a beautiful thing.
Well, and I think you just raised something really important. I am a doctor that people can lean on. I mean, my style, it tends to be pretty straightforward, but I understand the journey. I'm taking care of my own mother who's 90. I had, he's now passed away, but a brother who had severe developmental deficits. And I saw his journey and I helped my mom. I think it's probably part of why I went into medicine. So, I have a sense of what it's like to be a caregiver, and I know how confusing and isolating and difficult it can be. It doesn't have to be horrible. I mean, it's such a mixed blessing. You get to take care of somebody, and it makes you feel good that you're doing something good for someone you love, but it can be difficult too and overwhelming. And so I try to be there a bit to give information so that at least people feel like they are making informed choices. I may agree with the choice, I may not agree with the choice, but I think sometimes we don't even have all the information. Well, what's going to happen? Is this normal? How do I handle this? And sometimes, literally last night, I was on the phone with someone whose 94-year-old husband was constipated. Now, this was, in the context of he'd been hospitalized and been in rehab, and now he was home. And the nurse had said to her, well, just give him a particular, what we call cocktail of medicines that honestly would have caused an explosion in her not very mobile husband. And so she called me, she said, is there anything else we can do? And of course, there's plenty of other things you can do. And she was just terrified at the idea, and we won't go into all the graphics, of this explosion this man might have.
We all have an image of right about now.
And it wasn't anything that required a prescription. It was just a little gentle education on how these things work, what's harmful, what's not harmful, what to watch out for. And she said she felt much better after we talked, and she wasn't going to give the thing that would have solved the medical constipation problem, but might have created a significant social issue and mess in the house.
Right. And one of the things you said a moment ago was, an alternative to some heavy duty, the medical solution, which was giving her a lot of anxiety. And there's enough fear and anxiety for care partners without this add-on of these medications.
Yep.
So
Yep.
I really love that. And I know that the last time we spoke, you had mentioned also, people, care partners, or when we care for another, or even if it's just a patient who's going to call you, we end up putting our anger sometimes in the wrong place. So to bring a situation into perspective, what really happened, things like that, and we can get out of control in our minds about what's going on.
Well, when we worry about our loved one, and if we feel like something's not right, and many times when you're in contact with the medical system because something isn't right.
Right.
And the medical system can be a dangerous place to be, whether it's an infection that somebody got in the hospital or a complication. There's lots of reasons, including just the illness or injury you're dealing with that your loved one have to get really mad. And so it's interesting that you bring this up, because one of the reasons that I started this is I just saw so much suffering, especially of caregivers. And when I say suffering, I don't just mean what we all know, I'm working hard, it's taking up my life. but people also would get very, very angry at things that often were a bit displaced. Using the example of one of these, I'll give you an example where there was a complication that happened, and it happened because a medicine was omitted. And the family was really mad at the nurses. And it wasn't the nurse's fault. And
Right.
and I was able to explain why it happened. It's up to them whether they want to do something or not do something because the medicine was omitted. But they were thinking that somehow a nurse hadn't done what he or she was supposed to do, and that just wasn't the case. And I think it gave them at least a little bit of comfort to know kind of the source of the issue, and be able to then put their anger in the right place. If you want to be angry with somebody, be angry at this person, but not the nurses. They didn't cause it. They were actually trying to help it.
Right.
And I just see so much frustration, so much, and to me it's unnecessary suffering when something bad happens and you just don't know who to blame.
Absolutely. Absolutely. And it's so easy, you're right, to be angry or frustrated, or when we're really angry at the whole ball of wax, but we've got to pick one thing to like, pour our venom onto. Like for me, sometimes it's, the cable company. I mean, if you're in a bad mood, you pick somebody or something.
We all do that.
Yeah, we all do that. Um, well, doctor, so you can work across the country with people. I know that you locally see people, or you don't see them. You're really all telephone and video calling. Is that true?
Yes, although I can go, so for example, recently I went to the rehab facility where one of my clients was, just because there was they weren't getting the information and they were trying to figure out could they bring somebody home. And I just went and had a nice chat with everybody and figured out whether, talk to the therapist and talk to the various practitioners and the nurse, and was able to then paint a much clearer portrait for the family as to what would be needed to bring their loved one home. But
Excellent.
so I can go, and I can go to doctor's appointments if people would like, but generally most of what I'm doing is advising people either like this through a Zoom or by telephone. And I don't have any problem with talking to people in the evening because so many people work during the day, and I really don't mind at all talking in the evening or on the weekend. It's not like
Okay.
problems don't happen just during business hours. They happen often during those off times.
Right. Oh, absolutely. Absolutely. And I wanted to ask you, so I know that you have a way that people can retain your services, or they can have a kind of a one-off situation with you. So I'll be sure to, give your website and how to get in touch with you
Mhm.
before we end, but uh, how would that work if I wanted to be in touch, and, how would I retain you, or how would I even expect to pay you?
Well, first things first, I just encourage people to reach out to me and just set a time to talk. Just calling me, sometimes I might be, in the middle of Costco or something.
Right.
But, I'll likely talk to you same day, that
Okay.
evening or maybe the next morning, whatever works for us together.
Right.
And then I'll just talk to you. And then people can tell me what's going on. I've had any number of people who call me up, they tell me about their situation, and they don't really need what I do. Recently I had one lady who had specific goals. She knew her mother was in the last 6 months of her life that had been said, but she didn't realize the extent of services, comfort services that could be provided by hospice. And she had been thinking she was going to ask me to manage a bunch of things, but she didn't need me. She needed hospice for her mom.
Right.
And so I just told her that. So
Right.
my first thing that I encourage is people just to call me, and I'll talk to people for about half an hour, just to hear what the situation is. And if I can give them advice, that's just fine. I'm not going to charge somebody just for a single call. But if
Okay.
after we talk, it turns out that there's something that is needed, then what I've typically done is, depending on the situation, I charge an hourly rate.
Okay.
I do have one client that I've been with longitudinally, And we might get into just kind of a regular monthly fee, and then he can call me whenever he wants and doesn't have to worry, oh my goodness, how many hours, do I have left, kind of thing. Um, but yeah, then the process is simple. If we decide we're going to do it, we discuss the hourly rate. I ask for a retainer. I have a little HIPAA release and something that explains that I'm not acting as the person's doctor, and also that I can talk to other people on behalf, if I need to call other doctors or talk to the physical therapist. I want to make sure that the loved one, the person that we're talking about, is aware and agrees. So sometimes, occasionally, I'm contracting with having a relationship, a service agreement with the person with the illness, but most of the time it's with the family. So I actually want both to sign, because I would never do this unless a loved one was comfortable with me knowing their medical information.
Of course, right, absolutely. Uh, I just think this is such a valuable service that you're offering, and I'll be sure to be putting this in my private Facebook group, and I want to make sure that people can be in touch with you. So I'm going to say it very carefully, and then I'll post it when I do post this up. But your website is it's very simple,
Yep,
mymdadvisor.com.
that's it. And the
Uh,
business is My MD Advisor, because that's what I want to do. I want to be people's advisor. I'm not their doctor. I'm their advisor. I'm like that. I want to be like that good family friend that happens to be a doctor that helps you out. But not everybody has that good family friend that helps you out.
right. Excellent. Well, doctor, I'm so grateful to have you here.
Well,
Thank you. This is
thank
so
you, Cheryl.
valuable.
It's my
Yeah.
pleasure. Happy to help anybody that needs the help, and I really appreciate you being willing to talk with me and to put me up on your website. Thank you so much.
All right. Thank you. And I'll see you soon. Thanks.
Sounds great. Okay.